Hey everybody, I'm Dr. Harrington and I'll be talking to you about how to prepare for an embryo transfer today. So before the transfer process, we're going to make sure your labs are ready to go. The uterus has to be evaluated, sometimes with a saline sonogram or a recent hysteroscopy or some other reliable method to make sure there's nothing in there that could affect the pregnancy rate, like a polyp or fibroid or scar tissue. We're going to do a mock transfer, making sure we know how to get into the uterus. And then we're going to make sure that you're taking the prenatal vitamin with folic acid. Um, Sometimes there's multiple embryos that are available for transfers. If you haven't done PGT, we select the embryo that has the best grading. If you did do PGT, we can choose the best overall embryo, or if there's a specific sex that you and your partner might be interested in, we can choose that as well. So how does the process work? We got to synchronize the uterus to the age of the embryo. So we got to put it at a very specific time, mimic what happens in normal conception. And we can do it in two ways. We can follow a natural or modified natural cycle, or we can follow a control cycle where we take control. And I'll walk you through those two options. Sometimes there's type that's better than the other, but oftentimes it's a decision that the couple might decide or the patient might decide. There's pros and cons to each, and that's what I will walk you through today. But more importantly, success rates are the same for most patients. So don't pick one more than the other. We want to pick the one that makes most sense for you based on your preference. So when do you have to make this decision? So often this is guided by your doctor. So if they tell you one's better than the other, I would follow that advice, but you can have a preference. So it's good to start thinking about it. That's why we created this video, to have you think about it when you finish an IVF cycle and are waiting for results of genetic testing or just trying to get ready for the next step. If you think about it ahead of time, we can put that plan into action a little bit quicker. And then also, if you're thinking about it in the next few months, coming back for a second baby or something like that, you can think about it and let us know ahead of time so that we can prepare. Um, what embryo to transfer, you got to decide before the cycle starts, ideally. If we're waiting for results or there's a reason to decide after, we can certainly accommodate that sometimes, but ideally we know what type of cycle and which embryo we're ready to transfer so that you and your provider can make that plan and communicate it to the clinical team and the lab. So a natural cycle typically follows your normal timeline. So you get your menses. Sometimes you do a natural where you don't take Clomid or letrozole. Sometimes you do. It depends on your doctor's recommendation. You typically will come in for ultrasound and a blood work around day 10 to 12, then maybe 14, 15, 16. So you can see there's multiple ultrasounds you have to do. We're tracking that lining, we're tracking those follicles and trying to pick the perfect day to give you a trigger shot to release those follicles. And then we start a couple of days later vaginal progesterone and typically transfer on the 6th or 7th day after the trigger shot, depending on the labs. For a natural cycle, you may take no meds after menses, like I mentioned, or you may take letrozole or Clomid. Rarely we do it with injections. You know the date of your first ultrasound once your period starts. Labs are pretty often, so feels more like an IVF cycle minus those daily injections. Transfer date, we don't know and we can't plan, so we'll know it 6 to 7 days prior, but not sooner than that. So it could fall any day, and we schedule them on the weekend, but there's no real flexibility to change it. It probably won't fall with your doctor. When we do a controlled cycle, we take charge of things. So we'll give you estrogen pills or patches, depending on what your doctor recommends. We often need to bring you in less times to the clinic because we're in control of the cycle. We don't need to monitor it so precisely, although we will absolutely be very exact. And once we start the progesterone medications, your transfers happen on the 6th day of those medications. We sometimes do this after birth control pills. So you'll take some birth control pills and then start with your bleed, start the same kind of process. So in this type of cycle, we can choose the transfer date early on, and that means you can do it with your doctor, which we all love. We love doing this for our own patients. If we have to push it back, we can always push it back if we need to, if your lining needs more time or there's a reason. And we don't schedule controlled transfers on the weekends. We only schedule them Monday through Friday. So what are the pros and cons? It depends on what matters to you. But for a natural cycle, the main pro is less medication. You don't have to take injectable progesterone, only vaginal, and there's a potential decrease in pregnancy-related hypertension. Um, the cons are a lot more ultrasounds and blood works, and sometimes that's daily, so similar to an IVF cycle. There's less predictable dating, so you can't plan it, and you'll do it with whoever's there that day. There's a higher cancellation rate, so if the lining's not ready, if you ovulate early, if things like that happen, there's really not much that we can do. And if someone has really irregular cycles, it's not ideal. Obviously, if someone has reached menopause, also not ideal or not possible. When we do control, the main benefit is lower cancellation rate. You can move your transfer date. You can likely do it with your own doctor. And there's a little bit of a faster time to pregnancy, mostly because we cancel less cycles. In a controlled fashion, we have more control. The main downside of a controlled cycle, you need injectable progesterone. So most cycles at RSC are controlled, but certainly we're willing to work with anybody to do the right thing for them. We typically transfer one embryo. Your doctor will guide you as to what's the right number to transfer for you, but that's typically one. How to choose the embryo? We try to choose the embryo with the best chance of success. So there's no benefit of saving the best embryo for later. We want to move forward with your best embryo as quickly as possible. So typically we look at the embryo genetics and we look at the normal embryos to transfer first, and then we look at the morphology, which is how the embryo looks under the microscope. That's also known as the embryo grade. If you don't have a sex preference, we'll transfer the best embryo overall. If you do, we'll transfer the best embryo of the sex that you prefer. And it's really important for you to communicate to us whether you have a preference or not. And if you want to know the sex, oftentimes people don't want to know, and that's okay. We can tell you and then pick for you based on the one that looks the best, or we can keep it a secret if you prefer. So we're happy to accommodate either one of those. What to expect during your embryo transfer? You're going to get the precise day of your transfer once we know when the progesterone starts, but we don't really know the exact time until we make the schedule, and we make that schedule 2 days ahead. So 2 days before the transfer, we'll give you your time. We can't guarantee an exact time, but typically they fall between 11 and 5 p.m. You will be asked to empty your bladder and drink a bunch of water before. That makes the bladder fuller so we can see better, the transfer gets easier, and the outcomes are better with a full bladder. We have you bring your IDs, we have you avoid wearing scents or perfumes because they can harm the embryos, and we will review all of your instructions. Some people take Valium, which is a relaxing medication. So if you're planning on doing that, make sure you have a ride home because we don't have you do want to have you drive after the medication. Um, we will transfer it through a catheter, and we will have done a mock transfer to know what to expect in terms of how to get into the uterus. We'll look under the ultrasound to make sure we drop that embryo at the exact right spot, and then we'll cross some fingers and wish you good luck. We typically check 9 days later for success. Some quick FAQs. Is the transfer painful? It's usually painless, feels like a pap smear. Sometimes people have a little cramping or discomfort, but most of the discomfort's from that full bladder. The transfer procedure takes a couple minutes, about 10 to 15 minutes. Most of it is just preparation. The actual transfer is quite quick. In terms of the embryo transfer, what happens after? You empty your bladder, which you'll be very happy about, and then you can go home. Most people take it easy for a day or two, but you can really resume normal activities. You just want to avoid anything strenuous, any heavy lifting. You do not have to be in bed. Like I said, 9 days after, we typically test to confirm the pregnancy. Could be as early as 8, as late as 10. The success rates depend on many factors. Most genetically tested embryos have about a 60-65 success rates, but this varies. So ask your doctor to give you a more personalized expectation. All of our physicians have very comparable pregnancy rates, and our embryologists assisting in the transfer as well. So the outcome doesn't really have a change with what doctors do in your transfer, which is always reassuring for our patients to hear. And in terms of making a transfer more successful, we want you to follow a healthy lifestyle, maintain a balanced diet, good thing to reduce stress, although it's impossible to get rid of all stress. So just do what you can to reduce it. Avoid alcohol, smoking, any sort of bad habits, and then make sure you follow the medication instructions to a T. So any other questions, contact your clinical team. I hope this is helpful in preparing for your embryo transfer. And most importantly, good luck. Thank you very much.